So, good morning, everyone. The topic for me today is Garbhini Paricharya. Absolutely relevant topic to me at the moment, considering my situation, because I'm in my second trimester, just entered second trimester, and I'm really thankful to Dr. Nutan ma'am for giving me this opportunity for presenting this topic. If she wouldn't have given me this topic, I would have specially asked her to let me present this only. Okay, so going ahead, I give sincere gratitude to the divine energy for guiding me at every step in life, protecting me. Then I'm eternally grateful to my gurus at the Yoga Institute also for bringing yoga into my life and helping me spread it across and helping people with it. And special and sincere thanks to Dr. Nutan for encouraging me, supporting me, bearing with me, and solving my doubts at every step. And special thanks for today for letting me present this and being there for me in this journey. So going ahead, I'd like to ask a question to everyone. So I'll ask this question specifically to Anusha and Sharda ji. So since you have two kids, both of you, were you told specific things regarding your diet, travel, exercise, and work while you were expecting, and how different it was for you for the first child and the second child? So Anusha, you can start. You can tell us something about this.
Diet I followed according to my previous schedule only. Traveling, I was just taking care of myself and doing some acupuncture exercises during traveling. And exercises I did it for myself, whatever I felt like comfortable. And then I did all the household work. That's it. First, it was different, and second time it was different because I had to look after my first kid. That's it.
Right. Beautiful. And Shardaji, you would like to share?
Yeah, for my first one, I followed like diet. Yes, I followed whatever it was given at home. Travel, I didn't travel. Once I came for my delivery, like from the third month, I was at home. Exercise, whatever it was like done during the prenatal classes, I did it, but I was not very conscious enough, as I mentioned. Office work, I quit my work because I was pregnant, all this. But for my second one, it was totally different. I had my diet very consciously, what I like, what my cravings were. I went according to that. Travel, I visited Disney in around 4 months. 4 months pregnancy, I traveled to Orlando. Then exercises, yes, I did it very consciously. What I was doing, I knew what was right for my body. I did it. Office work, yes, I continued my work. So I think it was like a two different experience in all this. And thank you for reminding me on all this.
Thank you so much for sharing. And I'm also sure that the kids are also very different from each other because of what you followed for first pregnancy and second one. Okay. So like we are hearing two live examples here about how, diet and everything plays a very big role in a mother's life and eventually how a baby transforms from it. Okay. So moving ahead. Sorry, 1 minute. My slide is stuck, I guess. Is it visible now?
Yes, yes.
Okay. So the topic today is Garbhini Paricharya. So what does it mean? It means taking care of a pregnant woman and outlines basically a holistic approach to overall pregnancy wellness. So considering whatever we discussed in the previous slide and Anusha ji and Shahza ji also shared their experience, today I'm sharing these four basic aspects which I thought were very important to cover this in this topic. First is ahar or the diet that should be consumed during all three trimesters. Then there is Garbho Ghatkar Bhav, things that should be avoided during pregnancy. How yoga, third point is how yoga and meditation play a role here. And fourth is how activities and how do they affect the baby here. Okay, so it's very important to keep all these things in mind and follow something that really works for you because that really would help to transform a baby. Of course, we understand the soul factor is there and inherent nature is already present in the child, but I'm sure maternal factors also play a very big role here. Okay. So going forward, I start with ahar. Okay. Ahar, we start with consuming, this is, uniform across all trimesters I want to share here is first is that we should be consuming sattvic ahar, which, prioritizes, use of seasonal fruits, vegetables, eating whole grains like brown rice, legumes, lean protein, lentils, this kind of food. Very important aspect I felt here was also, and I also hear a lot while I read newspaper and other articles, is about seasonality and consuming what is local, fresh, available in your city at that point of time. We may understand that avocado is good for us, but is avocado an Indian produce? It's not. It's not. Maybe, maybe something else which can replace that local. If in Maharashtra something is grown, you should consume that. Maybe in Punjab, if something specific is consumed, you should consume that. So, for example, then we should be consuming sweet and juicy foods like ripe fruits, dates, honey, which really help to kind of nourish babies' growth. Then also you should be consuming easy to digest. And it's my personal experience. I've been loving eating khichdi at this point of time with ghee, and it really is helpful. It's kind of very digestive. It has helped me battle you know constipation, also fight acidity, so that's really helpful, and I'm getting protein also that way. And then obviously ghee in Ayurveda is very important component, as we say in our diet also, and ghee should be consumed because it really overall helps in lubrication and increasing the kapha in the body required. Okay, we all know that we should be avoiding spicy and acidic foods, heavy and oily foods, and caffeine and alcohol is an absolute no. Okay, then going forward, I also want to share something regarding to diets according to the doshas. So, for example, to balance out vata, we should avoid cold and raw foods. We should focus on eating warm, cooked foods. We should include nuts, seeds, and ghee for nourishment. For pitta, we should, not to aggravate pitta, we should keep in mind eating cool foods as well, which is like drinking coconut water or consuming cucumber. Limit and keep very limited acidic and spicy foods. Then on for kapha we should kind of binge more on maybe moong and light barley, lentils, which is lighter and does not kapha doesn't get too aggravated because lubrication is also required. Okay, then going on the monthly diet which should be followed per trimester. So first trimester is the first formative time wherein we should be consuming easy to digest food which is high on iron. Then second trimester should we should increase, and my doctor also specifically told me right now to kind of increase the calcium and protein intake a lot, because this is the time when organs, bones, and everything is getting developed for the baby. And third trimester is about continuing to eat healthy and healthy foods, increasing the fluid intake as well. And like said earlier, undercooked and raw food should be absolutely avoided. Then going forward, I would like to share the second point, which is Garbhasanskar bhav, the things which should be avoided in pregnancy. So, for example, I have broken it down further into physical, emotional, and environmental factors. So, first is it's very easy because the immune system is also little it gets a little weak here, so it is very easy to get virus and bacterial infections at this point of time. In fact was under fever last 2-3 days, uh, in spite of taking a flu shot as well as a vaccination which my doctor prescribed me. Then taking care, absolutely not running too fast, or you know uh, wearing uncomfortable footwear which could kind of lead to injuries like falling. Then medical conditions can also come up, like diabetes and high BP. So managing it with diet and yoga, and then taking care of absolutely in terms of medication to be absolutely consulted with the doctor and then taken. And not consumption, no, absolutely no consumption of alcohol and drugs. Then also emotional factors, for example, excessive stress can create a lot of issues for the baby, anxiety and depression. So all these things should be definitely managed with yoga, with meditation, with a lot of other recreational activities, or something that a mother really enjoys doing. And then environment also, like toxic radiations, all those things should be avoided. So I remember when I go for my scans, it's specifically written that pregnant women should not enter the x-ray place where x-rays are there. So very important to keep yourself away from there. These small things really really make a healthy and happy pregnancy without any fear. Then going forward, I start with yoga, which is the most important aspect here. For first trimester is like Shadaji also mentioned in her presentation as well about doing gentle poses that maintain core engagement, lengthen the spine, promote relaxation, keeping a normal happy sense for the mother. So we should be doing more meditative poses here like Sukhasan, Vajrasan, maybe also Parvatasana to kind of strengthen the spine, Tarasan without bringing the heels up, totally avoiding deep twists, back bends, extreme inverted poses like headstands or handstand, and absolutely no poses on the abdomen. Like so, no bhujangasana, no back bends, no dhanurasan. Pranayams we should start with Brahmri, Anulom Vilom, which really help overall in the first trimester. And this, like Dr. Nutan ma'am also has kind of shared her yoga module, which is so beautifully created, which is yoga first trimester is about yoga for stability, which is the 3S model. So this is about being stable. Then second trimester is about strength and flexibility. Now that first trimester is over, and usually mothers also get their strength back in this trimester, and they feel happy, more energetic. So it's a good time to kind of strengthen. And like ma'am had, I remember, had also shared in the class as well that Veerbhadrasan warrior pose should be done so as if you want a warrior child, a fighter, because as it is, the world is kind of, we need to create kids who are happy and who are able to stand up for themselves. But also that doesn't mean that we should be avoiding high impact jumps, overall like balancing poses. Everything should be managed considering your condition and talking to your after speaking to your doctor. This second is about flexibility and building strength. So Ujjayi, Brahmri, Pranayam, Nadi Shodhana, they really help. During this time, chanting can also be included, like Hanuman Chalisa can be chanted, Saraswati Mantra. So these really impact the womb and the baby a lot, and they really help in, creating a very beautiful environment for the baby. Then going further about the third trimester is about space creating. By this time, the uterus is kind of expanding to its maximum limit to accommodate the baby. So I remember somebody telling me that one of my friends, her doctor told her to do a lot of squats before delivering, because that really helps and supports in it. So during this time, Malasan, Badakonasana, hip openers can be done during this time, which should be avoided in first trimester, could be done at this point of time. But then at the same time, as don'ts, we should not be, lying on our, sorry, lying on our stomach and taking care of that. I'm sorry, just 1 minute. Sorry for my throat. Then pranayam, Brahmri, Nadi Shodhana, Ujjayi pranayam are really helpful. Meditation mein visualization should be done for a smooth and happy delivery. So going ahead, sorry, my slide is also stuck again. Is my screen visible now? Okay, sorry for the interruption and technical issues. So here now, after the yoga aspect and pranayams and meditation, I focus here on Vihar. Like, I remember ma'am also specifically telling us to cultivate hobbies at this point of time, that, and continuing what we really like doing. So maybe something like knitting, gardening, painting, whatever a mother enjoys, because this really relaxes the mind and kind of brings a lot of happiness to the baby as well. And sometimes we also experience that, whatever a mother did during that time in the womb, the babies also are born with those things, and they are also, interested in those hobbies as well. So going forward, the practical topic was couple yoga for me. So, pregnancy is a beautiful journey, like, and especially, of course, the mother is feeling the changes physically, mentally, emotionally, in every aspect. But fathers also have a very big role here to contribute. And so that's why, like we had done, so couple yoga is also very important to kind of, keep the partners aligned together, to increase the bonding in between them. So, it kind of reduces the stress. Of course, a lot of poses you will not be able to do in pregnancy, but it should be started before pregnancy as well, as and when a couple decides to, have their own family and start to have wanting to have a child. So reduce stress and it reduces anxiety, body awareness increases, mindfulness and presence. And then, there is a lot of gratitude and appreciation between the partners for this. So apart from this topic, I also wanted to share about Garbh Sambhad, which is very important aspect during this time, which is, how mothers should kind of start speaking to their child and telling them, like ma'am had also shared in the class, that, if we're eating something sweet, so tell them like this is sweet taste, or whatever we are reading, or beautiful scriptures we may be reading, we can, explain those to the baby. And then, also, like, because this aspect is there, I remember ma'am had also discussed one topic of food, which is fetal origin of adult diseases, which was, this concept came by Dr. David Barker, that, kids, adults grow till 40, 50, they are absolutely fine, and suddenly there is, a disease they would have, suddenly they would have high blood pressure, suddenly somebody would get would get a heart attack. It is because something happened during the time when they were in the womb, like with the mother, something happened, something, because of that this kind of originated in their adult life. So it's very important to, take care and, practice as much as you can, and especially support the mothers, pregnant mothers, and, keeping them happy in the mental happy mind state, which really is helpful. Okay, so thank you for the time and your patience, and I'm so sorry for technical glitches and my throat right now.